Dr. Nuri Motijo. So, your thoughts on this? Why is this happening?
Well, firstly, you must remember that pigmentation is a very debilitating disease, and it's very distressing because many women actually will not leave the house, layering on the makeup, trying to cover it up. So first and foremost, it is very debilitating, and I'm sure we'll get input from the psychologist as to what effect this is. But it causes a lot of women to be quite desperate, and they'll use anything that they can see a result from. The only problem is a lot of these products, like you mentioned, are dangerous, and they end up doing more harm than good. It is, just to correct you, we do have it available on prescription. The product name is called quinone, and we can prescribe it to a maximum of 5% in South Africa, but it has to be prescribed correctly. And we only use it for usually 6 months or so. And it's generally not indicated for skins, but we can use it quite safely in lighter skins.
The name of the product again?
It's hydroquinone.
Okay, hydroquinone.
Yes, the hydroquinone is the factor in it that causes the problem, as you mentioned, of the darkening of type of thing. So that is the one that is dangerous, yet works very effectively for pigmentation.
But do you think that the reason why people use this is simply for pigmentation? You know, the article that I made reference to was talking about some of the adverts back in the day, many years ago, where people were talking about facial improvements lead to an elevation of social standing. Has that got anything to do with it?
Definitely, because a lot of patients would just use it from a skin bleaching perspective. So not even treating a disease, but as in, for example, pigmentation, which is the chloasma or the melasma, but specifically just wanting to appear lighter. So they'd use it on their whole face and neck just for bleaching purposes. And the hydroquinone is a very, very good bleacher. So it does work. But after you use it for a long period of time, you end up getting a disease known as cosmetic ochronosis, which is a very dark deposition of black tissue on your elastic fibers, and you end up looking more darker than you did in the first place.
So there are two different categories then of people. There are people who use it because they have skin problems, and there are people who just bleach so that they look a lot lighter.
That's exactly it. Yes.
And that is a psychological problem, is it not?
I do think there's a huge psychological element when it comes to that. And there's also psychological debilitation with the pigmentation, but when it comes to just bleaching the skin, I do feel there's a huge psychological issue.
Hydroquinone, is that the only one available in South Africa?
No, there are other products such as arbutin, licorice extract, things like that. We're trying to now develop pigment lightening gels that don't have the dangerous hydroquinone products, and there are quite good ones on the market, a lot with scientific backing, and you can quite safely in patients, but it's generally for the diseases, the pigmentary diseases, because it doesn't end up really. It can brighten your skin, but it won't bleach it to the extent that the hydroquinone can.
And you're developing it for people who have skin problems, not for people who just want to look a lot lighter.
You may see a lot of the Clinique and the L'Oreals on the shelves that have, are for dark spots or brightening creams and that type of thing. But there are ones with a lot of medical backing there that are coming up used, but not going to be useful for the bleaching type, which is why the black market has now overtaken all of these products, and you can get hydroquinone available. Many of my patients tell me where they've gotten it available in higher percentages than we are allowed to prescribe in South Africa.
And I was going to ask you about that. Your normal makeup, does it contain any of these, I suppose, this skin lighteners such as hydroquinone and others, or
not?
No,
they shouldn't. It's not allowed to contain. In South Africa, we have very strict jurisdiction with the hydroquinone, so no, that shouldn't.
And if it does, then it's illegal.
It's illegal. But there's a huge illegal market. Unfortunately, we're still seeing new cases of cosmetic ochronosis, which is why we know that these products are available. Because we shouldn't, with the banning of hydroquinone, and I think that was in about the 80s, if I'm not, or early 90s, we shouldn't be seeing new cases of cosmetic ochronosis and the side effects of the hydroquinone now.
Okay, talk about this cosmetic, what did you call it?
Cosmetic ochronosis.
Oh, all right, what happens?
Okay, so what happens is you get a black deposition on your elastic tissue. And when you look at a person's skin, because our skin is basically made up of collagen fibers and elastic fibers, and when you look at someone's skin, they get these almost little black lumps on the skin. And sometimes it can be smooth, sometimes it's slightly lumpy, and you'll see it on the face and the neck in the areas specifically that they've applied the hydroquinone, and the sun exposure on the hydroquinone also accentuates the progression of this disease.
And I believe that over and above the ochronosis, then you also get people that suffer from leukemia, cancers of the liver and kidneys as a result of these skin lighteners.
There definitely is some evidence to show that there can be liver and kidney disease associated with the hydroquinones. Yes, but because you can even get deposition onto these organs with it. But generally, the most alarming effect for a lot of these women is the cosmetic, the appearance, because they used it to actually bleach their skin, and the reverse has happened.
All right, and you're saying you're getting a lot of cases from the black market?
Yes, we still get a lot of cases, especially in the hospitals. We see it quite often in Baragwanath, up in Joburg, Jen, and we still see new cases, which puzzles us because we shouldn't see new cases.
All right.
With the banning of the substance.
All right, Doc, let me thank you very much for talking to me this morning, just setting the scene for us then. Let me bring in my other guests here who will talk about these matters. Dr. Bana, your experiences for me, please.
Hi. Most of my experiences with my patients are people coming in, as the dermatologist said, more for pigmentary disorders, hyperpigmentation. So we have to make clear the difference between patients that come in for treatments just for hyperpigmentation. They're concerned about their pigmentation versus patients that want to lighten their skin for whatever social and cultural reasons. So most of the patients come through for melasma, which is a hormonal type pigmentation, and there are safe treatments that can be administered for that. But what I understand we're talking about here is more the
bleaching type,
unsafe treatment, and the way that people still go about trying to lighten their skin, because historically in this country and all over the world, skin lightening products contain hydroquinone as well as mercury and corticosteroids, and instead of patients taking them as directed, they'd overuse them or get them illegally where they're completely unregulated and have high percentages of these products. So,
sure. You speak about hyperpigmentation. What is that?
Hyperpigmentation is the pathological pigmentation of your skin. So it's hyper means excessive. So it's excessive pigmentation in certain areas of your skin.
Is that a disease, or do you find that there are people who naturally have that kind of pigmentation?
No, it's associated with, there's a few diseases that it's associated with, like systemic diseases, Cushing's syndrome, Addison's disease, but also if you know, very commonly pregnancy, it's called melasma. And it's caused by hormonal pigmentation, and in certain areas, pregnant women get a bit darker on their cheeks, on their foreheads, around their mouth, and it usually subsides after pregnancy. So in certain areas of your skin becomes hyperpigmented, which is an excessive pigmentation.
All right, Ziyanda, you've done a study here. Just tell me a little bit about what you were seeking to find out and what you found.
Just for the final research. For my studies, my partners and I actually were trying to explore the relationships between the psychological and physical well-being and products which produce artificial looks among black females, in particular. Unfortunately, our demographic is restricted to black females within our university. However, by artificial looks, we actually just refer to anything which is not part of one's natural physical being, being like weaves, braids, skin lightening, and hair relaxing. And our focus was on hair relaxing. So we did our research, collected our data, and we sought to actually hypothesize that these products and processes negatively affect the physical and psychological well-being of their targets. Negative effects referring to low self-esteem, identity issues, physical bodily damages, among others. However, in analyzing the data, I actually find that the perceptions fed by the popular culture regarding women, specifically black women and their naturalness, the dark skin, our kinky hair, have the direct negative effect. And these products and these processes are just seen as problem solvers. And they perpetuate these perceptions, and thus they actually indirectly affect our psychological well-being. So it all starts with society. Yeah, so that's the underlying problem.
Sure.
Just our society, the way.
We're going to come back to that because I find it very interesting. I really do. Leanne, do you think the students are on the mark, though? Is that what happens? Is that is there a relationship between the physical looks and the psychological state of mind?
Well, it's interesting that the hypothesis was initially that the products cause psychological problems, and they later found that psychological and social issues are actually at the root, possibly, of seeking out things like skin lighteners and bleachers. I think that you would need to look at both the social and the individual factors. I think that possibly there are racial factors or ideas that society might have adopted or internalized, that whiteness or lightness is more desirable. And that's obviously especially pertinent to the South African context with our history, but also more broadly internationally, that because of the history of discrimination, there might have been an idealization of whiteness or seeing whiteness as something desirable or to strive for, rather than perhaps celebrating black or African identity. And that internalization of that certainly has an impact on self-esteem, because there's something about not being adequate in your own identity. And as I said, you have to look at the intersection of the social factors and the individual. That if you have an individual with already self-esteem difficulties with regards to their body image, and then they're exposed to the social factors, then you have an individual who's at risk of wanting to change what they look like, not being satisfied with their body image and with how they look. So I think you have to look at perhaps for a follow-up study, one has to look at individual factors that put you at risk, but also the social factors and how, even unconsciously, we internalize whiteness or lightness as more desirable, more affluent, more of a higher social status, or something that we strive to. And there are suggestions of it being more healthy to celebrate one's own identity rather than striving to